Welcome to the event that the Princess of Asturias Foundation has organized to review the work of Gavi, the Vaccine Alliance, Princess of Asturias Award for International Cooperation 2020. The event, VaccinAction, is part of a cultural program with which the foundation aims to bring the work of every year's awardees closer to the public, and it takes place in the days before the award ceremony. Unfortunately, the circumstances imposed by the COVID-19 pandemic have not allowed us to have all the laureates in Asturias as we would have wished. We will try our hardest to make this virtual experience feel like the real thing. It is an honor to have with us today Dr. Seth Berkley, CEO of Gavi, and Dr. Pedro Alonso, Director of the World Health Organization Global Malaria Programme. I will first introduce Dr. Berkley and ask him to share with us in depth the work of the organization that he leads. I will then introduce Dr. Alonso, who will share with us more about the role that Spain plays in its contribution to Gavi. The last segment of this event will be dedicated to COVID-19 and the crucial role Gavi plays in this pandemic. Dr. Berkley and Dr. Alonso are long-term collaborators and sailing partners, and this segment will hopefully be a conversation between them. So welcome, Dr. Berkley and Dr. Alonso. It is a true pleasure to have you with us. Let me first introduce Dr. Seth Berkley, CEO of Gavi, the Vaccine Alliance. A medical doctor and infectious disease epidemiologist, Dr. Berkley joined Gavi as its CEO in August 2011, spearheading its mission to protect the world's poorest children by improving access to new and underused vaccines. In its 20 years of existence, Gavi has reached more than 820 million children in the 73 poorest countries. So in June of 2020, Dr. Berkley led Gavi to its third successful replenishment, raising $8.8 billion in the presence of 42 heads of state. He's co-leading the vaccine pillar of the Access to COVID-19 Tools Accelerator, working to develop and distribute a SARS-CoV-2 vaccine globally. Before coming to Gavi, Dr. Berkley founded the International AIDS Vaccine Initiative, the first vaccine product development public-private sector partnership, where he served as president and CEO for 15 years. He received his undergraduate and medical degrees from Brown University and trained in internal medicine at Harvard University. In 2013, he was awarded an honored doctorate by Nelson Mandela University in Port Elizabeth, South Africa, for services to global public health and advancing the right to health care for all. There's so much more to say, but I will just state that you have been recognized by Time Magazine as one of the Time 100 world's most influential people, and that your TED Talks have been viewed by more than 2.3 million people. You have consulted and worked in more than 50 countries in Africa, Asia, and Latin America. These are some of the few things to tell about you. And the question to you, Dr. Berkley, can you give us an insight on the work and impact of Gavi, its history, milestones, impact in the extraordinary decrease of the price of vaccines, the difficulties about the production of vaccines, the role of immunization in the health of the global population, and anything else that you consider relevant for us to know?
So thank you so much for that extraordinary introduction. And of course, thank you for this amazing honor, the Princess of Asturias Award, known worldwide. We are deeply humbled by having received this, and also at this particular moment in time when we are trying to pivot now to deal with the COVID pandemic, which I know we'll talk about with Pedro in the third segment. So let me try to introduce Gavi. And, to say that if you go back now, many, many years ago, there were no vaccines being distributed in developing countries. And there was an attempt to try to bring these powerful tools, which can save lives, forward. The challenge was, how do you bring together all of the players? How do you bring together industry to do this? And Gavi was born 2000, so 20 years ago. It was launched at the World Economic Forum, and it had a bold goal to try to bring all of this together and roll vaccines out. And I have to say, it's been quite successful. We have now immunized more than 822 million additional children, preventing more than 14 million deaths. We've rolled out vaccines across the world. We currently provide vaccines to more than 50% of the world's children. And it's not just a few vaccines. We started out with a relatively small number of vaccines, but over time we've added vaccines for new conditions. And today we have vaccines against 17 diseases. What has the result been of this? Well, we've seen a 70% reduction in vaccine preventable diseases. And we've seen more than 50% reduction in under 5 child mortality. Of course, not all of that can be attributed to vaccines, but these are really extraordinary accomplishments. It's estimated that there's been savings between $80 and $100 billion in these communities. Now, how does Gavi work? Well, the real dirty secret here was moving companies from a mindset of being low volume and high prices to a mindset of high volume and low prices. And so we started with a small number of companies, and we've grown from 5 suppliers in 2000 today to 17 suppliers, the majority of whom are in developing countries. And with that, we've reduced prices by somewhere between 90 and 98%, depending on the vaccines. Now, that's important because we also believe that our role is to help countries, give them a leg up, but not to create dependency. So when the countries start, they have to pay something. Everybody pays something, just a little bit for the poorest countries. As they get richer, they pay more until eventually they transition out of Gavi support. And we've had 18 countries transition out, and they're continuing to pay for their vaccines. But of course, if the vaccines were very expensive at that time, it'd be very difficult for those countries. So this process of working to try to create better prices has been critical to allowing these countries to stand on their own feet. The last thing I'd like to say is that, we work on routine vaccination, which is the most widely distributed health intervention. 91% of children now in the world get at least one routine vaccine. But we also work on outbreak diseases. So we keep the global stockpiles for yellow fever, for cholera, for meningitis, and now, of course, most recently for Ebola, because there now is a vaccine for Ebola. And we have that available for all countries. If it's a Gavi eligible poor country, we make it available with financing. If it turns out that it's needed in a wealthy country, we make it available immediately, and then they pay back those funds. The last thing to say is that we also, vaccines don't deliver themselves. So our role has been to strengthen health systems in countries. And we spend about a quarter of our finance in being able to build these health systems. So that's the past. Let me just say a few words about the future. So we're moving into what we call Gavi 5.0, which is the next iteration of Gavi. And it's going to be building on all of the great advances I just talked about. But what we're going to try to do is immunize an additional 300 million children and save an additional 7 to 8 million lives. So very ambitious on that. We want to take new technologies and bring those. Today, we're doing things from drones all the way to biometric applications, bring those innovations to countries to help them reach those that are left behind, the so-called zero-dose children. And that's very important because those children who live in those settings and they're clustered with other children, 2/3 of them are below the poverty line. If they're not getting vaccines, they're not getting any interventions. And so if they are to get sick, they're much more likely to have complications or die. So how do we extend out the health system? And the bold goal is to say, by 2030, by the end of the Sustainable Development Goals, if we can reach everybody with a health system, build out a resilient health system, this will not only be important for vaccine preventable diseases, but of course for all the health interventions that the populations need. So that's a little bit about what Gavi is and trying to do and what our plans are for.
So thank you very much, Dr. Berkley, for that short introduction, but with so much content. I'm now going to introduce you, Pedro. Dr. Pedro Alonso is the director of the World Health Organization Global Malaria Programme based in Geneva, Switzerland. The Global Malaria Programme is responsible for the coordination of WHO's global efforts to control and eliminate malaria and sets evidence-based norms, standards, policies, and guidelines to support malaria-affected countries around the world. A national of Spain, Dr. Alonso has spent over 30 years in public health. He has published over 300 articles in international peer-reviewed journals, primarily on malaria treatment, vaccines trials, and preventive therapies, and has served on several national and international committees. He has dedicated most of his professional life to the developing world and is a passionate advocate in the eradication of malaria. His organization, Centro de Investigación en Saúde de Manhiça, shared the Prince of Asturias International Cooperation Award in 2008, together with 3 other African institutions. My question to you, Dr. Alonso. Spain has announced 50 million euros in new funding to Gavi, the Vaccine Alliance, to both support the vaccination of hundreds of millions of children against diseases like pneumonia, measles, and polio, as well as support universal access to a COVID-19 vaccine. This new pledge is in addition to Spain's existing commitments for the 2021-2025 period for Gavi, amounting to another 47 million. Pedro, can you explain to us in more detail Spain's collaboration with Gavi? And with your knowledge of the malaria vaccine, many years in the making, could you give us an idea of the complexity involved in the creation of a vaccine?
Sure. Thanks so very much. And delighted to be here and delighted to be with my friend Seth. We're not far away from each other, but we're seeing ourselves across the screen. So let me start by saying that I applaud the renewed engagement of Spain in supporting Gavi and the pledge of a significant set of resources to support Gavi's work. Allow me to say that I think that that's simply a smart investment. It's a really important one. And I'm personally delighted to see Spain rejoining in a very active way the support for an organization which is a true example of smart public health, innovation, passion, and delivering real benefits to the populations most at risk. As Seth has just said a few minutes ago, the numbers that he has quoted are simply impressive. Now, how did Spain engage in this? I had a very modest contribution to that, but there's a good friend of all of us, Dr. Tore Godal, who's been a champion in so many important global health initiatives over the last 40 years, and who I had the fortune of knowing for, again, 30 years, one day phones me up when I was then in Barcelona, leading the Barcelona Institute for Global Health at the University of Barcelona, and says, Pedro, we're setting this up. We're setting this new initiative up. And at that time, people like Graça Machel, also well known to the Prince of Asturias Awards, was herself very engaged in that space. Can you help us establish a connection with Spain, with civil society, with academia, and eventually with government? And so we did. We were organized a fascinating event in Barcelona with the support of La Caixa Foundation, which I'll mention a couple of words in just a minute. Well attended by academics, well attended by civil society organizations, and well attended by government. Minister of Health attended, the Deputy Prime Minister attended. And I think I don't think that the decisions were taken there, but it certainly got the ball rolling at a time when Spain, I'm talking of the mid 2005, 2006, the first decade of this century, before the big economic crisis, and a lot of work around this international financing facility for immunizations, around the pneumococcal vaccine, and so on. And so we were very pleased to eventually see that Spain committed to the IFFM and the direct support to Gavi. Unfortunately, the economic crisis then hit the world, hit hard on Spain, and although they maintained that commitment to the IFFI, Spain actually withdraw from other major investments, be this in Gavi or the Global Fund or so. As I said, I'm truly happy to see Spain re-engaging with Gavi. It's a really smart investment. It's the right thing for Spain to do. If Spain is to put money, it has to put money. It has, if it is to honor its global responsibility, which it has, as a large and reasonably wealthy country, this is the type of investment to do. I'd like to just highlight that even when the economic crisis hit and the Spanish government couldn't actually maintain that type of impetus, civil society in Spain did. And La Caixa Foundation, I think I'd like to mention, because it's the right thing to do. The Infanta Cristina, through the La Caixa Foundation, kept on being a massive advocate for Gavi. La Caixa Foundation kept on investing in Gavi, and they do so up to today. And this is a great example, because you know very well, in our country, in Spain, we have a bit of a pendulum. Sometimes this is the fancy thing to do today, and we don't keep that over the years. But in this case, they've kept their commitment over the years, sometimes really complex years. So I think it's a great story, the one of Spain and Gavi, but one where we need consistency, where we need to keep that focus and just support an organization that is doing such an amazing and transformative work. On the second part of your question, vaccines are hard. Dr. Berkley himself was a vaccine developer in his past life. And I've devoted a fair amount of my time before I joined WHO generally in supporting the work of vaccines. And with Seth, we worked on the first global VaccinAction plan for WHO, but actually on the ground, developing on clinical development and testing vaccines and trying to advance them. And since the early 1990s, I've been involved in some of the, I guess one could call it, the pioneering work on malaria vaccines in Africa. And just to recognize that this is simply a hard, long, complex journey, from the identification of the antigen to understanding whether that antigen elicits protective immunity, to setting it through a delivery platform, to then performing all the preclinical work in experimental models and then moving into children. In the case of malaria, this is particularly hard because we don't have good, what we call surrogate measures of protection, elements of the immune response elicited in humans that allow us to predict whether a vaccine is going to work or not, something that we have for most other vaccines, not for all. And thus, for malaria vaccines, the only way to know whether it works or not, a little bit the same as is happening with COVID-19, I'm sure Seth will comment on this in just a minute. The only way to actually know whether it works or not is to test them in humans. Now, testing a malaria vaccine in humans means going to some of the complex places in Africa where malaria is highly endemic, and eventually testing it in children, which is the key target group, because those are the ones that really die of malaria. And you have to do this with the most stringent international standards, ensuring the safety of the participants, but in complex environments. And this is what we've been doing for many years. And just to give you an example, an area where Gavi is playing a key role together with UNITAID and Global Fund, but with the leadership of Gavi and WHO, a first generation malaria vaccine, which we were involved in its early clinical trials, is now being deployed in pilot programs in 3 African countries. And up to today, more than 400,000 children have been immunized, and data will tell us whether this can keep on being in a wider scale through Africa. This is more than 30 years of work. So that's the long answer to your short question. Vaccines take time. In some cases, we don't get there, like for HIV, or at least we don't get there yet. I'm sure we will eventually. But then in the case of malaria, a very complex parasite, it is taking 40 years to develop a partially effective vaccine. So vaccines are hard, but they are the most important innovation in public health that we can use. It has saved lives, continues to save lives, reaches the hardest to reach. It has therefore a key equity dimension in its capacity to reach the hardest to reach, and therefore we cannot sufficiently overemphasize how critical they are to support the research on vaccines, its translation and into implementation, and particularly for the most vulnerable population, which is the heart of what Gavi is doing.
Can I add a couple of points?
Yes, please. Yes, please.
So, first of all, thank you, Pedro, for those wonderful comments. And I thought I might start off by explaining what IFM is, because you use those letters, but people may not know. And the innovation that we try to do isn't only on vaccines or on delivery. This was a financial innovation. And the idea was, if governments would be willing to commit over a long time period and make a legally binding commitment, then we could go to the capital markets and raise money, and you could move the money around in time. So you could move it all the way up front and use it right away, or you could move it later if there was an outbreak to the right time. And so, as Pedro described, Spain made a long-term commitment, which meant even during the years of fiscal crisis, it continued to support us, and we were able to use that finance and continue to work on it. But I also wanted to highlight that Laetitia also used a really innovative mechanisms, because not only were they the first private sector supporter for Gavi, but what they did is they brought in their suppliers, their customers, and they said, if you will put money in, we will match that money. And then the Gates Foundation said, well, that's a great idea. We'll match the money that both of you put in. So for every euro that was put in, we ended up with 4 euros of support for vaccinations for children. So this innovation is really interesting and a way to leverage the type of support that's there. And the only other thing I wanted to say on the malaria vaccines is of something that Pedro has dedicated his life to, malaria control. But it's interesting, as he mentioned, the vaccine at least initially, wasn't seen to be that efficacious. But malaria is so common and so deadly for young children that it was estimated for every 200 children vaccinated, you would save a life, which of course would make it a very cost-effective and good vaccine. So this is part of what we're trying to do now, is understand in real life, can it be rolled out to the level it needs to be? Will we see those types of mortality reductions? And if so, even if not a perfect vaccine, it might be something that can be added to other interventions to move forward. And the last thing just to say is that I didn't mention it in my introduction, but it's important to say we are called the Vaccine Alliance because we're not an organization. We are working together with partners, with WHO, with UNICEF, with the World Bank, with civil society, with governments. And the idea is to bring everybody to bear and working together. And this is one of the ways we can keep our costs way down, our overheads very low. You know, right now our overheads are under 2.57%. And the reason is because we use the infrastructure and work of all of these partners to deliver across the world. And that, in a sense, as Pedro says, makes smart development.
Thank you, Dr. Berkley. Okay, we're coming into the last segment of this event. And so I would like to invite you both to share with us the role that Gavi plays in the COVID-19 pandemic and anything else you consider of vital importance for the public to be aware of in the times that we are living. So it's a conversation between the two of you. Whoever wants to start, please.
I think Seth should start for very many good reasons. One, because he's the recipient of the award. But secondly, and perhaps more relevant to you, this question is because he's playing a critical role in the COVID-19 response. And it will be extremely interesting to hear how he sees the development of COVID-19 vaccines and the role that Gavi will be taking in this COVID-19 facility to ensure equitable access of the vaccines to those that need, which is the heart of what Gavi does, but is now being applied to this pandemic, which affects both developed and developing countries, resource poor areas, and resource rich areas. So, Seth, you go. You're the right one to go on this one.
So thank you, Pedro. And just to start, when we realized that this was an infectious disease, an epidemic, discussions began on should we make a vaccine? Is this going to spread? Of course it did. It spread quickly. And a few months from its point estimate launch, it was in over 180 countries. And so then our response was, well, we need to make sure there are vaccines for developing countries because that's what we do. But what we realized at that time was if you go back in history, for example, to the 2009 swine flu pandemic, what happened there were a small number of countries bought all the doses up and they had doses, but nobody else in the world did. And we realized that if we just bought doses for developing countries, there may not be any doses to buy because they would be used by wealthy countries. So we, at that point, pivoted to the idea of could we create a global effort? And this was, a bold idea. We had no idea whether there was going to be interest. So we started with the 92 countries, low income, lower middle income, and small economies. And those we decided we would put together and create an advanced market commitment. That's an innovative tool we've used for pneumonia vaccines as well, for Ebola vaccines, something similar. And so we started to do that. But then we said, well, what about fully self-financing countries? What about wealthier countries, upper middle income and high income countries? And when we went out and asked, people realized the importance of the following understanding, which is critical, which is we are not safe unless everybody's safe. And the reason that's important is even if you had, for example, vaccine to cover all of Spain today, First of all, you never cover everybody, but also the vaccine is never 100% effective. And to be able to go back to normal life, to be able to travel and have tourism and commerce, you can't do that if there are huge amounts of virus circulating around the world. So we went out and said, is there interest? And it's been profound, the interest. Today, we have 78 high income and upper middle income countries that have also joined the facility and are going to use their own domestic health budgets to pay for vaccines. And there's another 23 that are saying they want to join, but haven't yet been able to work through the legal agreements to do that. So we're expecting somewhere between 190 and maybe 193 countries to come together to work on trying to drive this forward. Now, what our goals are is to try to have 2 billion doses of vaccine available by the end of 2021, an ambitious goal by any stretch of the imagination. And what's interesting is science has responded. Today, there are more than 200 vaccines in development, of which about 40 are in the clinic and 10 are in the last stage of vaccine development now. And so we will, in this quarter, be able to see whether any of those vaccines work or not. And that's going to be critical because even if they don't work, they'll give us critical clues on how we might want to change vaccines going forward. But in the meantime, we're planning for success. How do we build the delivery systems? How do we also work to make sure that there's enough vaccine produced to get out to countries? So we're asking manufacturers to go ahead and start producing vaccine even before they see if they work. If they don't work, they will have to throw those vaccines away. But if they do work, we will already have vaccines made that we can begin to roll out. The last thing to say is that vaccines, as Pedro has said, are very hard to make. And the average probability of success for a vaccine in the preclinical stage for average diseases, we don't know yet for SARS-CoV-2, but is less than 10%. When it gets into the clinic, it's less than 20%. So what the facility is trying to do is not have 1 or 2 or 3 vaccines, but to have between 10 and 15 different vaccines in a portfolio. And the idea there is that when we learn which vaccines are more promising, we can pivot the work to those vaccines, and the ones that don't work then can drop out. So this is how we want to try to solve the science challenge. The last thing I'd say is, of course, working with WHO, we have a whole set of new challenges. How do you have regulatory approval across the world? How do you make sure the vaccines can be labeled and used in different countries? How do we make sure that if there's any indemnification or liability that's needed for these new vaccines? Who should get them first? The current hypothesis is we should vaccinate health workers across the world, maybe up to 3% of the population, and then move to the elderly and high risk. But what are the high risk? In United States these days, it's in meatpacking plants and in nursing home attendants and in prisons. But in developing countries, maybe it's in urban slums or it's in refugees or displaced people. So what we're going to need to do is have bespoke plans for every country, but with a system to roll it out and to help make sure there's adequate cold chain to store vaccines, adequate supply chains to deliver those vaccines, adequate training systems. So this is going to be a all hands on deck, truly global effort to make this happen.
If I may, Maite, I think this is so important what Seth is saying, and inevitably when we see this phenomenal work, this drive, this unprecedented level of resources, the coming together of the research community, of the pharma, of R&D, talking of 200 vaccine concepts, or probably many of them are still not quite products, but already a good number of them in clinical trials. This the world had never seen. And inevitably the question is, will this represent a change in paradigm? We're doing this because it is affecting the entire world, including the high-income countries and the high and middle-income countries, but we had not quite seen this for problems that were not touching us that closely. And I dare even say that this may be an opportunity, unfortunately, to remind the world that infectious diseases remain central to our health agenda. I'm sure all of us have had this experience of talking with the very esteemed colleagues who say, well, you know, this infectious disease is something of the past. It's a 19th century problem or early part of the 20th century. Now, the frontiers of science and health is in cardiovascular diseases, in oncology. And this is an unfortunate sort of discourse that puts one versus the other. And we should move away from that. But we should move away from that, realizing that if there is something in human health that has the capacity to represent an existentialist challenge to all of us, that's only an infectious disease. Nothing else can put, as unfortunately we're seeing, that within weeks, if not just a few months, the entire world came to a stop. We've had this massive health impact, over 1 million deaths by now, economic havoc, potentially social and political implications. Only an infectious disease can do this. And if we link that with one of the greatest advances of human civilization, which is the development of vaccines, can we take this opportunity also to readdress that? When we've seen all this vaccine hesitancy growing and all diseases being reestablished in some of our own countries, and just to say, my friends, let us recognize infectious diseases are here to stay with us. They represent potentially an existentialist challenge to mankind, and vaccines are the key tool we have to fight these infectious diseases. Seth, do you see this, I presume, an opportunity, a challenge? Is this going to represent a change in our global mindset?
Well, I certainly hope so, Pedro. I mean, Bill Gates gave a very famous TED Talk in 2015 where he, quote unquote, predicted this. Well, what you don't know is there was a non-famous TED Talk back to back with his TED Talk, which was my TED Talk on how we create vaccines or have vaccines that are ready to go. And, we talked about the importance of having these tools for exactly this type of problem and how we could prepare ahead of time so we could move as quickly as possible. I mean, it is evolutionarily certain that we will continue to have infectious diseases. They've been with us since we crawled out of, the oceans. And, they will change, they will adapt. We will try to stay ahead of them. But with global warming, with the climate change, that is occurring, with desertification, with the increase in populations and population movements, with, tearing down forests and doing these changes, we are going to continue to have outbreaks. And so the question is, are we ready to do it? And I think what's extraordinary here is this is the largest multilateral mechanism since the Paris Climate Summit or Accord. It may even be larger than that now in terms of the numbers of countries that are engaging. How do we see this not as a nationalist strategy where everybody's out for themselves and competing with each other? How do we instead work to optimize this to get it to the people that need it? And that is going to be what is going to be important to move forward. And, in a world that recently hasn't necessarily been talking about that, I think this should make us humble and bring us back to where we are. Because if you don't have health, you don't have anything. You can be the richest guy in the world, you can be the richest country in the world, but if you don't have health, if you don't feel safe, you can't move forward. So this is the challenge for the global community. And I hope what Pedro said is right, that we learn from this and we use it. The challenge in the past has been, we have an outbreak, we have a big push, everybody is really serious about it, and then the outbreak is over and people forget about it. So for example, in the Ebola outbreak, in the middle of it, I was trying to get a vaccine, and we got one. It was 100% efficacious. It was a big deal. And at the time, everybody said to me, money's not the object, whatever it takes. And that was great. And the board said I could go and get this started and gave me money to start it. Right after the outbreak, I went to all those same people and said, well, how about giving me some money now to make a stockpile? And they were like, oh, Ebola, that's yesterday's problem. We're not thinking about that. And I think this is the challenge. Now, I suspect, given the magnitude of this, and just to put a number on it, the estimate is that, so far about $12 trillion in GDP loss, and the estimate is about $500 billion a month. So what that means is if we can move a vaccine forward by 2 or 3 days, we pay for the entire global effort. And of course, we're trying to move it forward by, 6, 8, 12 months. And so this is why we have to think about this in a different way.
I think you said that many important things, but I wanted to retain two, which many of us, including yourself, have been claiming for many years, but often not heard. So you said earlier, no one is safe until everybody is safe. And this is clear with COVID, but it is also true for many other infectious diseases.
Influenza.
And secondly, this at times false dichotomy, it's either health or economy. Well, there is no economy without health. Right. Even in our country, in Spain, and in many other countries, the whole dispute as to the measures to restrict movement, lockdowns, and so on, saying, oh, but this damages the economy. Well, there won't be economy if we don't actually sort out the health issue. And this relation, this vicious cycle of disease and poverty is one that for the more the economically more fragile part of the world, we've known for many years. There is no economic development without adequate health, and therefore promoting health is a key element to promote economic development. So I wish we retained these key elements beyond the COVID-19, because what applies to us now keeps on applying to half of the world that is not in the economic situation that or the economic development that we benefit from. But Maite, if you allow me, I have to ask Seth, because he knows that there is a vaccine which we talk a little bit about, but we haven't talked enough about. And I know he feels strongly about this, just like we do. And that's HPV vaccine, because this brings not only an equity dimension but a gender dimension, and it's a vaccine that prevents a cancer. So again, overcoming the unhelpful dichotomy of oncology or cancer versus infectious disease. This cancer is caused by an infectious disease, and it affects particularly women, and women in the most vulnerable parts of the world. And we have a highly efficacious vaccine, which now Gavi, which has had it on its radar for a good number of years, and did support some initial implementation work in a number of countries, is really now pushing forward. And I think it's such an important message for you to get across, Seth, that otherwise everything is at risk of falling under the shadow of COVID-19, which of course is very important, but HPV is so important.
So thank you, Pedro. And just to say that this is the second cancer vaccine, because hepatitis B vaccine protects against liver cancer. And so, my prediction will be we will find more infectious diseases that have a link, and we'll be able to prevent cancers, which is fabulous. So it's been one of my great disappointments, because we started out having to do demonstration projects with countries, because although we vaccinate children, this was reaching adolescent girls. And of course, there were sensitivities to that, and where to deliver that. Is that through schools? Is it through other mechanisms? But we figured that out, and we were ready to move forward. And lo and behold, manufacturers had not been able to produce enough vaccine for the demand that existed globally. So our plan was in this last strategic period was to get 40 million girls vaccinated. We ended up with less than half of that because of a supply constraint. The good news is at the Global Vaccine Summit, the replenishment effort that you mentioned before, we had a group of companies come together and said, we will make available the vaccines you need for this next strategic period. So if that happens, we hope to be able to immunize 84 million girls. And this is really important because in many countries in Africa, for example, this is the single largest cancer killer of women. And it's a terrible killer because, you don't know about it. You don't have any symptoms until you have stage 4 cancer, and then you die a slow, horrible death in the prime of your life. This is not, as we see sometimes, cancer for very elderly populations in the West. And so having this vaccine is a lifesaver. And this is an example of the power of vaccines and why we have to get them out to everybody as soon as we possibly can. Just to say that Bill Gates recently put out a statistic that was quite striking, which is that in the first 25 weeks of the COVID epidemic, the vaccine coverage levels dropped to that of 25 years ago. Now, our hope, of course, is that we'll be able to quickly recover and bring, those vaccines back in and make sure there aren't outbreaks and epidemics. But we don't know in the marginal communities if it'll be that easy. And so this is an important part of the challenge in front of us, is to rebuild those health systems stronger and better than they were, more resilient than they were, catch up on the people that were left behind, and then take these new vaccines that are so powerful and make them available to everyone.
Absolutely. You've mentioned Bill Gates and the foundation, which was also a Prince of Asturias awardee. I can't remember exactly what year it was. So you're joining, not because of the African Research Center, but also, but you're joining WHO and the Gates Foundation. And it speaks to the good work of the Prince of Asturias Foundation. I know Maite will soon start telling us, Pedro, you're running out of time. And
I was going to ask you, Pedro, you read my mind, if you have any last questions before we wrap up.
I have many last questions, and that means that
maybe one of them.
Seth and I have to go out for supper and catch up on many of these things. But Seth, I've been very troubled, and I know you've also been very troubled by anti-vaccine movements or vaccine hesitancy movements. So has Bill Gates and others. What do you think is the right strategy to deal with this? It is such an unfair, such a position of lack of solidarity and understanding of science that I often I'm left speechless. But you're good and articulate, and I know you have a good view. How should we deal with this?
Well, I mean, it is a challenge. And if you look at it, there is a demand continuum. On one side is a set of family members that say, I will never take a vaccine. And that's a very small percentage. On the other side are people who will walk, and you've seen this, 10, 12 hours to get their children vaccinated. And then there's all those in the middle. And what we're trying to do is move the people in the middle towards those that appreciate vaccines. Now, there are two issues that happen here. One is one of ignorance and not having people understand. And that's something that we can solve pretty quickly. But what's happened more and more is the politicalization of science, the idea that we don't trust governments anymore, we don't trust scientists, we don't trust data. And then with the tools we have now, by the way, on the first vaccination, which was smallpox, right after smallpox, there were cartoons about people who were going to grow cow ears out of their heads and things like that because the original vaccine came from cows. There's been an anti-vaccine movement everywhere, but what's changed with social media is the ability for these rumors to move at the speed of light. And so, anti-vaccine, misinformation in the United States can be in Nigeria at the same time, and they look on the same platform. So the challenge for us has been, how do we both try to have people, because when somebody goes to a social media platform to get information, they probably want real information. How do we make sure they get real information? How do we make sure they don't get linked up with false information? And how do we stop the interventions that are being done to try to dramatically hurt populations? And so, for example, there are Russian bots, the same ones that were involved with the US election interference, that would go out and put information pro-vaccine and anti-vaccine at the same time to create confusion and lack of trust in systems. Those types of things have to be stopped. So, you know, WHO has named this one of the 10 biggest challenges. Dr. Tedros has called it an infodemic of misinformation. And this is something we have to stop because, again, we have to remind ourselves that these are parents who care about their children, want to protect them. And, you know, with this misinformation, they may avoid getting a vaccine that ultimately is life-saving for them. So this is something that we all have to work on together.
And before you allow me, because he's mentioned the first vaccine and Jenner and smallpox, and that's 1796. And you know what, at a time when there was no email or phones and so on, within 4 years, several cities in Europe were being immunized with the smallpox vaccine. And in 1803, and that's something we should one day talk about, on how to create a prize about this, because it's vastly unknown. The Spanish crown, and we're talking now of the Prince of Asturias, the Spanish crown through King Charles IV organized what was called the Royal Philanthropic Expedition. That meant, and that set sail in 1803, so barely 7-8 years after Jenner's observation, to immunize, and they sailed to the Caribbean, into Cuba, then all the way down through the Americas, up Mexico, up to California, across to the Philippines and into China. And that was probably the precursor of Gavi. That's how do you actually translate scientific innovation into a public health action. The Balmis expedition, it's known about, and believe me, you tell this to Spanish medical students and they know nothing about it. But it is a great precursor of what Gavi is doing, and I just take the opportunity to congratulate Seth for his amazing leadership and the organization for the amazing work they're doing.
Thank you both, Dr. Berkley, Dr. Alonso, for this wonderful conversation. Pedro, your intervention has been key here. You've made it so much more important and crucial. Dr. Berkley, congratulations again on winning the Princess of Asturias International Cooperation Award. And we hope to see you in Asturias next year. Thank you both.
I certainly hope to be there, and thank you for this honor. And it's been great to chat with both of you.
Thank you very much.
Thank you very much.
Thank you.